Hi friends, welcome back to my YouTube channel Holistic Homeopathy. So today again we'll be studying another homeopathic remedy called Rustox along with its indications mainly for the injuries. So how Rustox is indicated when there are injuries and what are the important modalities which help us to select Rustox and differentiate it from another homeopathic medicines. So let's begin. So Rhus toxicodendron, common name is poison oak. It belongs to the family called Anacardiaceae, and its main affections is on the joints, tendons, aponeurosis sheet, which is a fibrous sheet which connects two joints. So basically, indicated for injuries of ligaments of the joints. Important ailments from when we prescribe Rustox is for strains, overlifting, then after getting wet in rains, especially while perspiring or when overexerting oneself and getting wet, think of remedy Rustox. So sprains could be due to overexertion. Sprain could be of single or group of muscles. Sprains could be from lifting weights like in gymnast or person who do exercises. And sprains from stretching arms to reach things when you reach for object to catch hold of something. So good remedy for sprains of different types. So when you indicate for injuries, the affected parts are inflamed and are dark and red in color. The pains are more in the muscles and tendons, and the characteristic of the pain as if it has been torn from its attachment, as if the bones were scraped by a knife. So that kind of a sore pain is there when you think of giving Rustox. There is lameness and stiffness and pains of various kinds which are worse on first motion after rest. So when a person starts to move about, there's an aggravation of the pain. But by continuing moving about, the pains are better. Like walking continuously, the pains of Rustox are better. So there's a definite relief from motion, and motion always ameliorates in Rustox. And the pains are worse at rest, which is opposite of bryonia, which is better by rest and worse from motion. There's a lot of rigidity due to contraction of tendons in the joints, and so the limbs are feeling as if stiff and paralyzed. It could be a good remedy for post-operative complications, then for rheumatisms which are worse in cold and wet weather. And cold, fresh air aggravates, it makes the skin painful. So anything cold, cold air, cold wind, cold application, or cold water aggravates the Rustox patient. So in nerve pains, mainly for ulnar nerve pains, then sciatic pains, which are pains extending from thighs downward. These pains are also worse in cold, damp weather, and they are more worse at night. Then the sciatica, mainly for left-sided sciatica, Rustox could be a good remedy. Lumbago, lumbar back pain is also worse from motion when the patient is attempting to rise, beginning of the motion. So complaints from overwork and overexertion are most important indication of Rustox. So other indications which help us to differentiate Rustox from other remedies are which are not related to injuries. Like there's a lot of restlessness, especially physical restlessness with anxiety and apprehension in Rustox. And this apprehension, anxiety is worse at night, but there is a fear of death, being poisoned, and cannot remain calm in bed. So it is more of a physical restlessness as the patient is better from moving about and motion. So patient cannot lie down calm at one place. He has to keep on changing position to obtain relief from the pains. So the tongue of Rustox is very characteristic. It is of brown, dry, cracked or red. Especially there is a triangular red tip of tongue, and the tongue could be smooth and red. So triangular red tip of the tongue is a good indication for prescribing Rustox. There is a lot of great thirst with dry tongue, mouth and throat in Rustox. Eruptions in Rustox are more of a vesicular type, and there could be redness and edematous swelling with itching and burning. Again, itching, burning, and skin eruptions are worse from cold air or cold draft of air. So another indication for Rostock is for hypertrophy of the heart, is enlarged heart from overexertion, like in sportsmen or gymnasts or marathon runners who have the enlarged heart. Think of Rostock's as a remedy, and there's a sense of numbness in left arm along with the heart symptoms. So it could also affect right side more in general than left side. Sciatica is more on the left side more. The patient in general of Rustocks is chilly, very sensitive to cold. So any uncovering of hands from the bed covers brings on cough. This is a good indication for Rustocks, and it is quite similar to Baraita carb and Hepar sulf. Cough on uncovering or exposing the arm, a least draft of hair. Think of Rustocks along with Baraita carb and Hepar sulf. So in general, all the symptoms are worse during sleep at night, in cold, damp, rainy weather, and from rest. And back pains can be worse by lying on back or right side. In general, the patient is better from warm, dry weather, better by continuous motion like walking. Also, by warm application, the patient is better and stretching the limbs. So, when we study Rustox, other complementary remedies to Rustox are Brownia, Calcarea floor, and Phytolacca for rheumatism. When comparing Rustox, we have to compare with Brownia, Aconite, Calmia apis, Arnica, Rhododendron, Natrum sulf, and sulfur. So in urticaria, Rustox when indicated, we have to compare it with Bovista, which also has the edematous swelling of the skin with urticaria and itching. And Rustox is inimical with Apis mellifica. So when you give Rustox, do not follow it with Apis. Or, keep this in mind. It is quite inimical to Apis Rustox. So this is a short description of the remedy Rhus toxicodendron. So I will just brief out on a few important indications. Again, the pains are better from continuous motion. Most important, pains are worse from beginning of motion, and pains are worst at rest. And pains in general are worse in cold, damp, and wet weather. In a chilly patient, along with the anxiety, restlessness, which is more of a physical restlessness, with triangular tip of the tongue, this all indications will give a good clue on prescribing the Rustox. So friends, if you like this video, please do like and subscribe to my channel for many such videos. Thank you so much.